Okay, so we're going to review the circulatory system. So when we talk about the circulatory system, there's some main components. There's, of course, the heart, there's blood, and there's blood vessels. So we're going to review all those components to the circulatory system. So as an overview for the heart, it's a muscular pump that circulates blood. It's that pumping action that forces blood to flow throughout the body. It's located within the thoracic cavity. It's located between the lungs. It's posterior. So if we remember about posterior, it's behind your sternum, and it's located anterior to the vertebral column. So in front of the vertebrae. So in between your breastbone and your backbone. It rests on top of the diaphragm, and it sits just to the left of the middle of your chest. So if you think about where your breastbone is, it's just to the left of that. And it's enclosed by the pericardium, or the pericardial sac. That's that outer covering that's going to enclose the heart and provide some protection to it. So when we look at the structure of the heart, there's 3 layers. There's the epicardium, the myocardium, and the endocardium. So epi, we've talked about epi, that's outer layer. So that's the outermost protective layer of the heart. It's very serous, which allows for that to move smoothly as the heart's contracting and pumping, so that it's not rubbing on anything else. And it's very vascular, so it has a lot of vessels that come to it that keep that good blood supply to the heart. Excuse me. The myocardium, that's that middle layer of the heart. It's the bulk, because that's the muscle of the heart. It's the muscle that provides all the contraction, that performs the whole job of the heart. The endocardium, that's the inner layer. It's very smooth muscle that lines the inside of the heart, and it also makes up the lining that's in the valves of the heart, as well as the continuation of the type of tissue or muscle that's in the vessels of the heart. So let's talk about the chambers of the heart. There are 4. You have 2 top chambers and 2 bottom chambers. The 2 top chambers are called the atria. That's plural for atrium. So 2 top chambers, you have one on the right, one on the left. So the right atrium. The atria, though, what's important about them is that they're the receiving chambers. So the right atrium and the left atrium. The right atrium is going to receive blood that has not, all its oxygen has been used. So it's deoxygenated blood. And it receives that from this big vessel called the vena cava. But the vena cava has split. And it's coming into the heart. So the superior vena cava and the inferior vena cava come together and both feed the heart. Because they're carrying blood to the heart. The superior, if we think of superior, we think of top. So that's bringing blood just from your head and your neck and your upper extremities, so your arms. The inferior vena cava is bringing blood back to the heart from the lower part of your body. So if we think of anything inferior to the neck, so your thorax, your chest, your pelvis, your abdomen, and your lower extremities or your legs. So that right atrium is receiving that blood that blood's delivered all oxygen, so it's coming back to the heart. The left atrium, that's receiving blood from the lungs. So 2 parts there. The 2 ventricles are the lower chambers of the heart. They pump blood as well, as we know, through the heart. The lower chambers, there's a right and a left. So the right ventricle, that receives blood from that top right atrium, that top chamber of the heart. From the when it goes through the right atrium and into the right ventricle, it's going to pump blood to the lungs so that it can get all that new oxygen that it needs to bring back around to the heart. And the left ventricle, so the left bottom chamber of the heart, that's receiving blood from the left atrium, or the left top of the heart, and it's returning it to the body and its tissues through the aorta. So let's go over that one more time. And I think that you watched a video that does a little bit better job, but the vena cava, so that's the big vessel that's going to bring blood right into the right atrium. It's going to go through the valve of the heart, which we're going to talk about next, and it's going to go into the right ventricle. From that right ventricle, it's going to go into the pulmonary arteries, and it's going to go to the lungs. That's where that oxygen and carbon dioxide exchange is going to happen. And then it's going to come through the pulmonary vein, and it's going to come into the the left atrium, It's going to go through the valve into the left ventricle. From the left ventricle, it's going to go through the aorta into the rest of the body. So the valves, those are flaps of, we talked about the tissue, that endocardium has a smooth muscle tissue, and there's valves in between each chamber of the heart as they're going in between chambers and as they're leaving the heart. So you have an atrioventricular valve. There's two of those because they're in between the both atria and ventricles, so it helps blood flow downward. You have the tricuspid and the bicuspid. So the tricuspid is on the right side. It's between the right atrium and the right ventricle. It's a tricuspid because it has 3 flaps that open and close. The bicuspid is between the left atrium and the left ventricle. It's called the bicuspid because it only has 2 flaps. Semilunar valves are located at the base of those. It's in between the vessels and the ventricles. So the pulmonary, as the blood is leaving the right ventricle and it's going to the pulmonary artery. If you think about that, the blood's delivering, it's leaving the right side and going to the lungs. So it's the pulmonary valve. As the blood leaves the left ventricle and goes into the aorta to go to the rest of the body, that's the aortic valve. So at the bottom of those ventricles, as it's going into the big vessels of your body, there's valves there. And those valves just keep the blood flowing in the right direction so that it's not going backwards. When we look a little bit more at the pathway of blood, the top chambers of the heart contract together and the bottom chambers of the heart contract together. So when that happens, it's kind of like there's 2 pumps to the heart. There's a right side and a left side. So the right side is pumping blood to and from the lungs, and the left side is pumping blood to and from the body. When we look at how the blood is supplied to the heart, we talked about how the heart is, of course, a muscle, and it contracts, and our muscles always need oxygen and nutrients to function. So with our heart being one of the most important muscles in our body, it's supplied with coronary arteries. So there's a right and a left coronary artery, and they branch off into lots of smaller branches of coronary arteries. There's lots in the body, but those big ones are the right and the left, and that's how the blood is supplied to the heart. If we look a little bit more about the physiology and how the heart works, we have a conduction system in our heart. It's the electrical part of our heart. And what happens in this conduction system is that there's impulses that are sent throughout the heart to stimulate the heart to contract. So we have the sinoatrial node, or the pacemaker of the heart. That fires very quickly. If we think about how many times our heart beats in a minute, 70 to 80 times on average, that node fires 70, 80 times a minute. It's sending those impulses to the heart, telling it contract, 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 contract. And that's sending them to the right atrium. The atrioventricular node is also in the right atrium, but it fires at a slower speed. So everything starts in the right top side of the heart. It's a little bit slower because it wants to allow the ventricle to relax before it sends another impulse telling the heart to beat again. So if we look at that entire cardiac cycle, it takes about 0.8 seconds to occur, which is really fast. But that cardiac cycle is the alternation of contraction and relaxation in those chambers of the heart. And this is where our blood pressure comes in. So if we talk about systole, that occurs during contraction when blood is being pushed out. So systole, contraction, blood goes out of the heart. Diastole, that's the relaxation of the heart. That's the chambers when they fill with blood. That's more part of the heartbeat, but it's relative when we talk about blood pressure as well. So when we talk about how that cardiac cycle happens and how our heart makes a sound when it beats, we refer to that as the lub-dub of the heart. And that's caused by the opening and closing of those valves. So the lub, that's that AV valve. That's the valve between the atria and the ventricle. And as that closes, it makes a sound. That's the lub. When you hear the heartbeat of lub-dub, that's the top, the first noise that you hear. That dub is the closure of those bottom valves in the ventricles. So lub-dub, pause. Everything's at rest. Lub-dub, pause. So if you think about that sinoatrial node firing, lub, dub, pause. So that's why you hear that. That's what you're hearing when you're listening to a heartbeat. Let's move on to talk about blood. Blood is that liquid connective tissue in our body. It's the only connective tissue that's liquid. We have several functions of our blood. It helps with transportation, so it carries oxygen, nutrients, hormones throughout the body. Everything our body needs is supplied and carried through the blood in our body. It also helps eliminate any waste products in our body. It helps regulate our body temperature, so the heat from our muscles as they contract, it helps move that heat throughout the body where it's needed. And it also helps regulate our fluid and electrolyte balances to make sure there's enough fluid where is needed in our vessels as compared to our body and our cells. And it helps make sure that those are all balanced, those fluids and electrolytes. When we talk about sodium and potassium, those are very important to the function of the heart. So it's important that those electrolytes are being balanced for our heart to function correctly. It also has protection characteristics. So it helps with clotting properties and also carrying those white blood cells and antibodies that we need to fight off infection. Our blood is composed of plasma and formed elements. So plasma, we've talked about that. It's that liquid part. All of our blood is liquid, but plasma is that yellow, sticky, straw-colored part of your blood that when it's separated, you can see it. And it's about 90% water. That's a lot of water. And then the second part of the blood is those formed elements. So our red blood cells, our white blood cells, and our platelets. Our white blood cells, let me back up. Our red blood cells carry oxygen. They're important when we talk about hemoglobin because red blood cells help carry our oxygen into all the needed parts of our body. So iron, B12, and folate are important in producing those red blood cells. So when we talk about someone who maybe has anemia, their hemoglobin is low. They don't have enough hemoglobin in their body to carry the oxygenated blood or to carry the oxygen in their blood around to their body. You maybe have heard of iron deficiency anemia or B12 deficiency anemia. If they're low on B12, there's not enough B12 to help support that production of those red blood cells. That's what's causing their hemoglobin to be low. So that's why they might be getting B12 injections. Maybe they're on iron for the same reason. Maybe their iron is not high enough to help stimulate that red blood cell production to make sure that they have enough hemoglobin in their body to carry the red blood cells and the oxygen where it needs to go. White blood cells. We know these are important for fighting off infection. So that's why it's important in the blood so that we have those, we can stay healthy. Thrombocytes, those are also known as platelets. Platelets are just fragments of cells. They're sticky and they clump together when our blood needs to clot. That's what is released if we are cut. Then platelets will be released to that area and will help form a clot so that we can stop bleeding. When we look at stopping bleeding, we're talking about hemostasis. That's vascular constriction. So smooth muscles contract to help restrict blood flow to that area. So if we're bleeding, your vessels are going to constrict, so they're going to be smaller so that less blood flow can reach that area so that we don't bleed too much. Platelets. We talked about platelets and how they're sticky. They clump together to form clots. So when we're bleeding, those platelets are released to that area of injury or damage and a clot is formed so that we can stop bleeding. And then our blood also has coagulation factors in it. Those help form blood clots and can either help form or help inhibit blood from clotting. When we talk about coagulation, it is important that our blood clots when we need it to. But when there's some type of injury in our vessels, that's when those clots can also form in those vessels. Blood types. So we've all heard of blood type, and we all have a blood type, but what blood type you have depends on which antigens you have and what develops as you're growing in utero. The Rh part, that is just the positive or negative portion. So if you're A positive or O positive, whatever blood type you are, that Rh factor is what decides that positive or negative portion. So blood vessels. We have different types of blood vessels in our body. We have arteries, capillaries, and veins. Arteries carry blood away from the heart. The major artery in our body is the aorta. And we have arterioles. Those are branches of small arteries. The capillaries are kind of the connection between it all. They're very, very small. They're a continuation of those arterioles, and they help connect the arteries and the veins. The veins, those carry blood to the heart. Our main one is that vena cava that we mentioned. The vena cava brings blood into the heart. The aorta carries blood away from the heart. Circulatory pathways. So there's two ways that our blood goes. We've talked about that, the right side and the left side. The right side is our pulmonary pathway. It carries blood from the right side of the heart to the lungs and back to the left side of the heart. The systemic part carries blood to the rest of the body and its tissues. Those are different. Pulmonary, you think just with the lungs. Systemic, you think it goes to the rest of the body system. So let's talk a little bit more about the lymphatic system. So we've talked about the lymphatic system before. Lymph, as we remember, is that fluid. It circulates through the body. It flows very freely through the body, and it helps with maintaining our blood volume and our blood pressure. So our lymphatic vessels, those are the vessels that just carry our lymph fluid through our body. It's a free-flowing system. There's no valves or pumps or anything like that. It just flows freely through our body. Through that fluid, we have the lymphatic organs that produce those lymphocytes that can be released to an area that's foreign. So if we have an infection, our tonsils, our spleen, our thymus, those are those areas that generate all those lymphocytes or white blood cells and releases to that area of foreign particles or whatever's foreign in the body. So you have lymph nodes, which are filters within that lymphatic system as well. So you have lymph fluid containing lymphocytes that move through lymphatic vessels through our lymphatic organs, or from our lymphatic organs. If you ever hear about a woman, and I always think about a woman because this happens a lot in mastectomy patients, so a woman who's had a breast removed, maybe from breast cancer, may also have some lymph nodes removed. When that happens, you are interrupting the lymph system, so that fluid that flows very freely is interrupted. So they will ask that their blood pressure not be taken, and they've been instructed to do that because when you take a blood pressure, you're obstructing flow, and so that can cause some backup of the fluid and just can create more of a problem. So that's the reason behind women who have had mastectomies and lymph nodes removed not having blood pressures taken on that same side of the body. As we talk about white blood cells, we look at resistance to disease. So resistance and susceptibility. Resistance, you have the ability to counteract the effects of anything harmful that's entered your body. Susceptibility, you don't have that resistance, so you're susceptible to infections. We have some defense mechanisms within our body that are specific or non-specific. So non-specific, we have first line, second line, and third line. Some first-line defense mechanisms that are non-specific are like skin, mucous membranes, and our fluid moving out of the body. Non-specific first-line defense mechanisms are your skin, mucous membranes, or fluid moving out of the body. We know our skin, our integumentary system, that's the biggest protection that we have. Our mucous membranes, like our mouth and our nose, fluid moving out of our body. So when we empty our bladder, fluid moves out of the body, pushing bacteria away. Or when we're sweating and we have that more of an acidic fluid in our sweat that can help kill bacteria and microorganisms as well. Some second lines of defense are that phagocytosis, where our white blood cells are eating bacteria, and then maybe some inflammation. Third line is immunity from your lymphocytes, so your body's response, that final step to getting rid of some type of infection or harmful substance. Some specific defense mechanisms that we have, you have some specificity, so a specific response to a specific antigen. Our body remembers. We have some memory defense mechanisms. So the body remembers specific antigens from a previous exposure. So when you've been sick before and you've been exposed to a certain illness, virus, bacteria, your body will remember that and remember how to fight against it. Antigens, those are those non-self cells that the body has created as a result of some type of injury or illness, So antigen, a non-self type of defense mechanism or cell that the body's created as a result of some type of infection. Immunity, that means that we have resistance. We have the ability to fight off those harmful substances or infections. We can have active immunity when our body responds and produces those memory cells, and we can have passive immunity that comes from vaccines, where our body is given a vaccine and then it helps to prevent that bacteria or that virus from infecting us. When we talk about aging of our circulatory system, aging causes the heart to be smaller. We have less muscle cells and we have less demand because elderly patients are usually more inactive. So the heart muscle isn't used as much when you're inactive, and so it makes it smaller. You're not strengthening your muscle. You can have some thickening of that endocardium. We talked about the endocardium, that inside layer of the heart, which is the same smooth muscle that is also in your valves and your vessels. So they're not as flexible as they once were, which alters the blood flow through the heart. It can make the blood flow backwards, which can lead to congestive heart failure because the blood is kind of backing up through your body. You can have changes to that conduction system, so the heart isn't firing like it should be. So then you have irregular heartbeats. That's where atrial fibrillation or atrial flutter comes from. It's the atria of the heart. Those firing nodes, that pacemaker of your heart isn't working correctly. There's also lots of disease processes like diabetes that can cause some atherosclerosis or hardening of the arteries. That adds added stress. So if you think the heart we talked about how there's the thickening of the endocardium. And if that happens because of aging or because of a medical condition, another diabetes or something like that, and those arteries are hardened, the heart is having to work really hard because there's not that elasticity of those vessels. So it has to work a little bit harder to get that blood to pump around in the body. Sedentary lifestyle, we mentioned when you're inactive, there's not as much demand, which makes your muscle weaker. Poor diet can also affect. So if you're eating a lot of cholesterol, you're having hardening of those arteries. The heart has to work harder to push blood through the body. Smoking takes up a lot of the oxygen in your body. So you're not getting good blood or good oxygen supply, not only to your heart, but to the rest of your body. So that's why smoking is huge. Smoking also can add to those hardening of the arteries and adding that stress on the heart. Sometimes that sedentary lifestyle, poor diet, and smoking can be more of an effect than just the aging process alone. So that's why stress on a healthy diet and good exercise is so important to the circulatory system.